The ABIM Foundation paired frontline physicians and leading experts to discuss building trust in healthcare. Lolita Al-Qureshi, MD, a physician, and Gwen Darien, a patient advocate, focused on efforts to build trust by empowering patients.
Well, my name is Lolita Al-Qureshi. I'm an associate professor at the University of Chicago, and I'm a pediatrician.
Great. My name's Gwen Darien, and I lead patient advocacy and engagement for the Patient Advocate Foundation and the National Patient Advocate Foundation. And I am a long-term patient advocate and a 3-time cancer survivor, so I have multiple lenses, and I have multiple questions to ask you about your really kind of incredible work.
Cool. I'm excited.
So I wanted to start out with just exploring a couple of two themes, or the sort of theme that I think is the overall theme that you talked about, which is the way of using an EHR, electronic health record, to facilitate communication and to build trust, because I think that's sort of the heart of what you're doing here.
Yeah.
And so this is the foundation of the story, and this is the foundation of what you're doing. And so if we could just start there, that would be great.
Yeah. So, the way that I came about making this comic was when our clinics went live with the EHR, and it was a process. And, I got to be an IT fly in the wall, just watching patient interactions. I was trained as a super user. And so I was in the room as my colleagues were seeing their patients, and I was able to witness firsthand how this thing was really changing that dynamic, and not in a good way. And it's really what inspired us to look at, what are the ways that the computer, the EHR, impacts that patient experience on both ends.
Right.
And not just the behaviors and the nonverbal communication, even though, and the verbal communication, even though that's super important, but how does it impact it from the perspective of the patient? What do they think?
Right.
And that really helped us identify the things that we wanted to stay away from, and then the things that actually helped, ways that you could promote the engagement, promote shared decision-making, really make it a collaborative tool that could be used together. And that was kind of the birth seed of it all for us.
Because I think that, I don't think I've ever heard anybody say that an EHR could be a way to build trust. We usually think of it as the barrier to trust and the barrier to the distancing and the mediator to communication.
Yeah.
So that was really, that's fascinating about this project.
Yeah, and we called it the positive deviant. So when we did our literature review and we found all these studies, there was a small core group of studies that had these positives, and it was exactly that using shared decision-making tools real time with a patient, so that you're reviewing stuff and what do you think, and just really fabulous little examples, but not many, because so much of what you see is it's so burdensome, so many clicks, and just the weight of charting and all that, and it's all very negative. But there are these little positive areas that I think are inspiring.
Right.
And as much as we can capitalize on those and not be weighed down by the negativity, I think that's fun. That's interesting. Ways that, and it's not just the EHR, like you have a computer with internet.
Right.
Use it, capitalize on it. I tell our medical students, build your tech toolkit of tools, websites, apps. This is my go-to handout. Like, just think creatively. If you were in the other chair, what would you want? What would help you understand what's going on? Tap into that and just build your resource kit.
And I think it also speaks to sort of the difference in the way that people interact with their doctors than they used to, and their healthcare providers and doctors and advanced practice nurses. And I mean, a long time ago, you expected your doctor to know everything. And if they didn't know everything, you didn't trust them. Now I have to say, so I had an interaction with my oncologist, and she said to me, and she's highly trained, I love her, and she said to me, let me just make sure that the guidelines haven't changed for this drug I wanted to give you. So rather than 20 years ago, I would have said, oh my God, you don't know anything, I need a new doctor.
Right.
I was saying, wow,
Yeah.
she is a really careful doctor. She's using the EHR and she's using the internet.
Yeah.
So this idea of what we can learn from the internet has also changed what practice has been. And I think that's another really interesting part of this project, was this idea of using the internet.
Yeah. And it's almost like, we're in this together. Let's
Right.
journey together. Let's
Yeah.
figure it out together. And that's the whole
Right.
thing about, sharing the screen. Let me bring you in.
Yeah.
Let's send this prescription together. Like, this
Yeah.
is your chart. So
Yeah.
you should own it. You should feel like you can get involved.
Right.
And that discussion doesn't have to stop
Right.
when that clinic visit is done. Let me tell you about the portal, and you can access your entire care team. That conversation, that dialogue can extend beyond, the 15 minutes in the confines of that room. So, I think it's really almost like a gateway to let's create your chart together. Let's come up with the answer together, and it feels less heavy.
Yeah.
I think
Yeah.
it's I'm not doing this alone. You're not doing it alone. We're kind of doing it together. So let's do it.
Yeah, so let's hold that thought one second and then step back to do this the context a little bit around it, because I think one of the things I was really struck by your the conversation about sort of honoring the golden moment.
Yes.
Because I think that one of the ways, I think that people sort of jump to the middle of the conversation often in this. So many of us and many patients, and you may have had this experience of patients, is that the physician doesn't come in and talk to you. They immediately look at the computer screen and then turn to you. And so one of the things that I think was so successful about the way that you presented this, and then I want to talk about the comic and some of the other aspects of it, was that you put it in the context of the whole visit. So that there were ways of setting it up so it didn't feel like a barrier. It felt like a tool.
Yes. Yeah. And so exactly, honor the golden minute. So when you walk into the room, even though you need to log on, don't make that the first thing you engage with, because that tells you, oh, yeah, you're there, but I need to focus on this. This thing has my attention, and it has it over you.
Than you. Yes.
It has it over you. And just physically, the act of the first touch is so important in medicine. Yeah. The physical act that you touch that first and you don't touch your patient is just so wrong. Yeah. So
that's a critical point.
It's so important. And, I can pull up your chart. In fact, I should have reviewed it beforehand. So I can kind of set the stage. I can figure out, why I think you're there. But let me open that up to you. You tell me why you're here. Right. What can I do for you?
Right.
And then, exactly like you said, when it's the right time to bring it into the conversation, then you do so naturally. Okay. And you don't let it dictate the conversation.
Right.
You guys determine the conversation, and then you pull this in when you think it can enhance it.
Uh-huh. So that's what you mean by patient-centered EHR use?
Yes.
Okay.
Yeah. Finding a way that you could use it that's unique to each patient. Some patients might not want to engage with it, and that's okay. And some may, what is that? What are you clicking there? And some people may be overly interested in it. Gauging that and then using it to provide them their specific education, making it specific to them, honoring their values, their wishes, but EHR patient-centered care that allows them that opportunity.
Yeah. So let's talk about how you came to do this comic as a way of helping to create this really more patient-centered way of using an EHR.
Yeah, so this is the comic that we created, and it's called Computers in the Clinic, Your Role. And so we set it up ABC format, super simple, super easy. A, asked to see the screen. And so there's an example of where the provider isn't doing that, and then another one where they are doing it. B is become involved. So review your records with your doctor that you can ask questions. And then C is my personal favorite, and that's call for attention. If you feel you have something important to discuss, if you feel like the provider's too focused on the computer and isn't paying attention, you can wave your hand and say, hey, redirect back to me. So yeah, and it's colorful, it's visual, it's fun.
And it's available to anybody.
It is freely available to anybody that wants to use it. They're cool.
Yeah, they are cool.
They're very neat. In fact, when we were passing them out, like as part of the study, people were like, "What's that? I didn't get one. Let me see that." And the kids love them. And so it's fun. It's engaging. It doesn't take a lot to explain it. In fact, we didn't explain it. We just gave it to them. So in terms of the resources to implement something like that, they're really minimal. It can convey your message really clearly, and it's a narrative, which I like because it's all building the narrative. It's a story to let you tell your story.
Right.
And we have a diverse patient population, so we needed something that could appeal to, somebody that had a PhD and somebody that didn't finish high school and everything in between. So it was a cool, fun kind of vehicle that we could do that. And we created not just the patient comic, but we created one for providers too.
So you created the two of them.
Yes. Yeah. So the provider one, the title of it is "Which Would You Prefer?" And on one side, it gives a not ideal way of using the computer with a patient, and then on the other panel, it shows you a more ideal way. And it's the same as this comic. It's 3 different core kind of behaviors that we found both through our own experience and in the literature. And we put the comic up in their workspaces.
Right.
So where they were charting, there was a big one on the door. You see it when you go in, you see it when you come out. Because even though we had built curricula to train providers, and we did this big 4-hour CME thing with the Cleveland Clinic. We did standardized patients, and that is very intensive.
Yeah.
And the people that were coming to the training were already really good communicators. They were just, upping it to the next level. And the people that we weren't able to get was the busy doctor that's in the room that's charting. And so we thought, well, let's just put them up in their workspaces and don't even have to explain it. It's right there, and it's just a little primer to say, you know what? When you walk in the room, just think about the person on the other side. Which would you prefer? How would you like it?
Right. And because all doctors are patients at some point or
We
another.
all
We
are.
all are patients. Everybody.
We all are. And our husband is a patient, and our kids are patients, and
Yes.
the shoe will be on the other foot.
So tell me a little bit. One of the things that was really interesting to me was the how this seemed to close the gap even more from patients who were in traditionally underserved populations.
Yeah. So that finding that in persons that were of minority ethnicity, so African American and Hispanic patients, found the comic more empowering. It encouraged them to get involved more. They actually took steps to get involved. Self-advocacy things, like if the provider was paying too much attention to the computer, it gave them more than our white patients kind of the courage and the authority to do so, to say, hey, I'm over here. Can we focus this back on me? Or asking, can I see that? Can I see this in my chart? And same goes for patients that had lower educational attainment, that they were more likely to take part in these, I call them EHR self-advocacy behaviors. And I think probably because these populations, not just in medicine, but in life, have maybe not had that kind of opportunity, didn't know it's their right as compared to other populations. So maybe these are more vulnerable, more marginalized populations. And, I personally don't maybe necessarily need the comic because I know that's my right. I could do that. That's my chart. I can get involved. But if I don't,
Right.
I haven't been invited to this discussion, this conversation. This is almost like the invitation to say, like, no, this is your right. It's
Right.
everybody's right.
Right.
Let's engage together. So,
I think that it is, I mean, one of the things that we've been thinking about and talking about is this notion of power differential. So it sounds like the comic helped equalize the power differential and gave the patients, particularly the underserved patients, a sense of what their power was in this relationship.
yeah. And I think what really speaks to that were some of the open-ended
Right.
comments that we got from patients that really got at the core of it. It wasn't so much the computer, but one of the most striking comments was somebody said, I really liked the comic because I didn't know I could ask questions.
Right.
Which is like,
Yeah.
what? You didn't know you could ask questions? Of course you can. This goes beyond
Yeah.
the EHR and the internet. And this is like at the core. Of course, this is a partnership. And if you don't trust in that, if you don't think you can ask questions, like,
Right.
we're not going to get anywhere.
But I think many patients don't think they can ask questions, and they aren't invited to ask questions. So I think this was the other thing that I found really really kind of very progressive and groundbreaking about this, is that it really facilitated that notion of being able to ask questions, because I don't think it's just a traditionally underserved population. I think it's the difference of being in a gown in the doctor's room. I mean, it doesn't matter. Your self-advocacy skills fly out the window no matter who you are.
Yeah.
But this idea that you were given this sense that the doctor and your healthcare provider and the system trusted you enough to give you the permission to ask the questions and see the screen. That's a really powerful thing to see, because I don't think we're not used to that. We're not used to seeing the screen. We're not used to somebody showing us our chart.
Yeah.
It stays away from us. It doesn't come towards us. And I love that idea of this kind of triangle and this space of being able to really ask questions, and not just being given permission to ask questions, but being encouraged,
Yes.
being told you're a partner, that you're not just a subject or an object. So this is really great. I mean, and it's also so simple. That's the other thing that is
simple.
amazing. It's just incredible. It's so simple.
It's what your grandmother would tell you. It's what your mom would tell you. It's like, use this as a positive. When it's not the right time, don't use it.
Right.
And use it with me.
Yeah.
Because it's ultimately their chart. In fact, we should be asking permission.
Right.
Can I open up your medical chart?
Right.
Can we co-create your narrative together?
Right.
Yeah.
So what's next?
So we're looking at ways that we can try and scale this up so that it's not just, in certain departments, but that it's part of our message. This is who we are. This is how we're going to involve you.
Right.
And this is what you can do to kind of get engaged in that process. This is a relationship. So.
And do you think of it beyond the EHR? I mean, the EHR was the impetus for this and the genesis of this, but it seems like it is potentially a blueprint for other.
Yeah, for sure. And it at the heart of it all, it's trust.
Yes.
Yeah.
All right, Lolita, thank you for such an incredible conversation. That was really, I look forward to seeing how you're going to use this. I look forward to seeing how you're going to scale it. And I look forward to the fact that these simple solutions can make a really profound change in trust and in communication. So thank you so much.
Thanks so much for having me.
Visit buildingtrust.org to learn more